As the program will attest, we face so many interconnected challenges here related to things such as public health, food security, or I should say food insecurity, governance issues and problems associated with governance, environmental degradation. And we understand, I think that the participants today really understand how fundamentally interconnected many of these issues are. What I think we can argue is that these are not isolated issues, but rather they're symptoms of systemic problems, of systemic dysfunction.
Access Alliance serves and contributes to the development of the community by providing interprofessional care system. And we have a community-based research department that generates evidence according to the need of the community by incorporating members of the community for the betterment of the community. We have very learned panelists, a group of panel members. They are scientists, they are researchers, they are academics from different disciplines. The diversity is not only from institutions. The diversity in our panelist group is from perspective. We'll hear them so that we can define how to fill out the gap, blind spot in our current movement of social prescribing.
These are all people that we work with and we have worked with as an agency for a number of years, and they're particularly important to me, to the agency, and to the communities that we serve and care for. The immigrant and refugee community is a particularly important community to many of us, but the work that all of these big brains have been involved with do make a difference to us. Research is critically important. The exchange of knowledge is incredibly important. We have a team at Access Alliance who does a lot of work in terms of sharing knowledge, making sure that the knowledge that the researchers are generating gets out into the community, and that this should be an enjoyable experience, and it will be, because we will hear lots of really good information, detailed information at times, and information that should push us to do better.
So social prescribing, there's always a client, a unique individual who has their own strengths, their own interests, and then there's a prescriber. So that could be a healthcare provider that identifies some non-medical issues and makes a social prescription. And with a lot of our member centers, we're fortunate enough to have someone who takes on this link worker or navigator role. We started with the pilot in 2018, so we used the model that was being developed in the UK, and we had UK mentors come and support us. And we delivered this in 11 different CHCs across Ontario, and social prescribing looked different in each community. So the most common prescription was food security, followed by Black-focused community events, arts activities, connections to other programs and services. And what we found was that 88% of our survey respondents worried about running out of food before they had money to buy more, either often or sometimes. And in the past year, 40% of survey respondents reported not being able to afford balanced meals often or sometimes.
And so really having those social connections are really important for, as a preventative measure, so that people can actually stay well and out of the hospital, and maybe when they go to the doctors, that it's not because they're lonely, but because they actually have medical issues, because we are suffering overcrowding in our EDs and other things like that. And having those connections are really the pathways to better physical health.
So the workplace and employment and working conditions are a huge, big, factor in terms of the social determinants of health. One of the things that we know, if a worker worries about going to work and feels like they are going to feel unsafe or they are going to get injured, that is a very serious problem, and that is actually experience of a lot of immigrants or refugees.
One thing that resonates is the things that keep us healthy is not health care, right? It's our life.
Community-based participatory research is essential for the future of public health. So it's not just about the individual health status of all of the people who happen to make up a community, but rather is at a higher level of analysis, a higher level of abstraction to say, these are the things that make this community healthy. So it's not necessarily about health per se. Community development is not necessarily about community health, but it is about intervening in the social, political, commercial, and other determinants of community health.
Currently, we're working on 7 projects, which can be seen here on the slide and listed in the report itself. In total, since 2015, we have funded and started 52 research projects in collaboration with 77 unique partners. From these projects, we've managed to publish 39 publications, which have been cited over 570 times across 21 unique journals with the voices of 105 unique authors. We've acquired over $2,480,000 in funding. Our work has also been presented at a number of workshops, webinars, panels, and conferences, including the conference today.
Immigrant make up about half of the COVID-19 cases at the time during the pandemic, although they only contribute to 25% of the population, so a very high number. The racialized immigrants have been affected quite hardly. This wasn't really a surprise to anyone, because this really reflected a long-lasting structural inequities that existed in Canada and also other parts of the world. As you all know, many immigrants work in high-risk, low-paying, precarious jobs, often in essential services with limited workplace protections. They are also more likely to live in poverty, in overcrowded housing, and face barriers to accessing healthcare. These social and economic challenges contributed to higher exposure to the virus. In Ontario, cancer and mental health and addiction are among the leading causes of mortality and morbidity. These findings highlight how clinical conditions intersect with social disadvantages to amplify infection risk. Key recommendations included engaging internationally educated health professionals as community health ambassadors. Second, connecting newcomers to health and social services early on during their settlement process, starting as early as when they go for a medical examination for immigration purposes. Third, expanding the reach of community health centers. They are often the only access point for those without a family doctor. The fourth recommendation from this group was creating a centralized provincial health portal with multilingual, culturally safe information. We heard a strong call for cross-sectoral collaboration to address root causes of mental distress among newcomers, co-designing programs with communities to ensure they are grounded in lived experiences and cultural values, mandating cultural competency training for frontline workers with a focus on anti-racist, trauma-informed care, and finally, improving digital and health literacy as many newcomers struggle to access virtual care or navigate health information.
I hope that each and every one of you is leaving this gathering this morning filled and feeling very comfortable, not bloated or anything like that, but feeling very comfortable in all of the nourishment that we have been able to receive, because each of these people is doing the work that they're doing in the various areas that they are specializing in, the commitments that they have made. There was a moment when, in one parts of the meal where we were talking about Access Alliance and the impact that it had. And I had a whole bunch of different moments during that, feeling very proud of the work that Access Alliance has done over a number of different years. The people who are in the research department, who are all extremely committed. But most importantly, all of the work that we've done has always been done in partnership. It's been done in partnership with the big brains. It's been done in partnership with the people who are a part of the communities that we do this research work with, and that is the importance of community-based research and an important part of what Access Alliance does and what Access Alliance believes in.